Hi, my name's Dr Ranj and I'm here today with Dr Narveed Sarwar for this episode of Cancer Explained, where we talk about how testicular cancer is treated stage by stage. We're going to guide you through the most common symptoms to look out for, learn how people get a diagnosis and the different treatment options available. Dr Narveed, welcome.
Thank you.
Tell us a bit about yourself.
I'm a medical oncologist that specialises in the treatment of testicular cancer.
So let's go back to basics. What actually is testicular cancer?
So cancer happens when cells start to divide more rapidly than normal. So those cells can continue to divide, and as they continue to divide, they can start to form a clump of cells. In testicular cancer, these cells arise from the body of the testes, and they then continue to divide and grow rapidly, which then forms a lump.
So this can affect anyone with testicles, basically. So we're talking about men, trans women, and anyone assigned male at birth.
Yes. It typically affects young men, so in a range between 25 to 40.
What sorts of symptoms might you experience?
So you may experience a lump in the testes or a swelling. Usually it's painless, but sometimes as it starts to grow, you may get a dragging sensation in your testes, and sometimes it can be painful. Usually if you do have any new symptoms or any new swelling, it may not be anything serious, but it's important to go and see your GP.
So you've noticed some symptoms, you've gone to your doctor. What sort of tests might they do?
So your GP would normally examine your testes, and if they are concerned, they would normally send you for an ultrasound scan. An ultrasound scan is just a picture of looking at your testes, and so they use sound waves to have a look at the testes in a bit more detail. It's usually a painless procedure. It usually involves a probe, which looks like a microphone, to look around your testes.
Similar sort of scan to what someone who's pregnant might have to show the fetus?
Yes, that's exactly correct.
So you've had your ultrasound scan done. What might it show and what happens next?
So the ultrasound scan may just show that you've got a cyst, which is a fluid-like structure, and may not show anything serious. But it may show that there is some abnormal cells there they can see as a lump, and in that case there may be a suspicion there may be a cancer in your testes. In that scenario, your GP will probably refer you to a specialist to have a further discussion about the next steps.
And what are the next steps?
Again, your specialist will probably examine your testes again. He will probably do some other blood tests. We know that patients who have testicular cancer sometimes produce some proteins or chemicals that are released into the bloodstream. So we would measure those by doing a blood test.
And they're called tumour markers, aren't they? If there is a suspicion of cancer, what happens next?
The only way to really prove there is a cancer is usually to try and take a piece of tissue to look at it under a microscope. So in a lot of other cancers, that's what we do. We do what we call a biopsy, is where we take a sample of that tissue and examine it under a microscope. In testicular cancer, we normally remove the whole testes. Part of that is because taking a sample tissue may miss the tumour.
So you take the entire testicle out rather than taking a small piece of it?
Yes.
And you leave the other testicle in?
Yes. So that procedure is something called an orchidectomy. Usually there's an incision they make in the groin, and the test is removed in its entirety.
And that's done as a small operation?
Yes, a day case, so people will go home on the same day.
Once they've taken that testicle out, what happens?
So that testicle is sent to an expert and to examine it under the microscope. That would obviously allow us to determine if this is a cancer. Testicular cancer usually broken up into two main forms, seminoma and non-seminoma. Knowing that allows us to kind of plan and guides us in terms of treatments as well.
And are there any other tests that you might have done?
You may have a CT scan, and that's done to find out if the cancer has spread to lymph nodes.
What are lymph nodes exactly?
Lymph nodes are part of the lymphatic system, and we have a collection of lymph nodes all over the body. So this is some of the lymph nodes in the pelvis, and these are some slightly higher up. So cancer can spread either through the lymph system or through the blood system as well.
So you do the scan to see whether the cancer has spread outside the testicle, and that helps us decide treatment. But it also helps with something called staging, doesn't it? Tell me about that.
Yeah, in testicular cancer, we have 3 stages, stage 1 to 3. So in stage 1 testicular cancer, the tumour is confined to the testes.
So stage 1 is restricted to the testicle. Tell me about stage 2.
So in stage 2, the cancer cells have spread to beyond the testicle. So they start to spread to lymph nodes in the pelvis, as well as outside the pelvis in the abdomen. So we start to get some further spread. Sometimes it may only be one lymph node that's enlarged. Sometimes it may be multiple lymph nodes that are enlarged.
And then it can progress to stage 3. What's that?
So stage 3 means the cancer spread further beyond the abdomen. It can spread to the lungs and other distant lymph nodes, as well as to the liver as well.
Ryan was 23 years old when he was diagnosed with testicular cancer. Earlier, I spoke to him about those early signs and symptoms. If I can take you right back to what life was like before your diagnosis.
Yeah, so I was 23. Genuinely felt like I was in the prime of my life. I was the fittest I've ever been, the strongest I've ever been. And I just met my now wife. I was also an NQT, so I'd just finished my first year as a primary school teacher. And I was going to be a fully qualified teacher that September.
And when did you first start to notice something wasn't quite right?
So it was in the summer of 2017. Me and one of my best friends back home, we decided to book a holiday. But I started noticing a bit of back pain, but I put it down to sort of muscular, doing like I said, doing a lot of sport, doing MMA. But while we were on holiday, the first thing I noticed, we had a bit of a strange moment. We were on a boat party, believe it or not. Don't judge me. As we were going on the boat party, my legs went completely numb and I just kind of collapsed on the floor. And I asked my friend to sort of help me up and he was very confused. You know, after about 5 minutes or so, I kind of managed to regain the sort of sensation in my legs and then flew back home. That was the first sign of something being a little bit weird.
So you get back from holiday. What happened then?
So I just thought I'd leave it and see how it goes, as any typical bloke would. I've got a twin brother. He was driving to work. I was in the passenger seat so I could take the car. We share a car. And as we were getting towards where he works, one side of my body went completely numb and I just passed out. He sort of kind of like was shaking me and I could feel him there, but I just couldn't really move or do anything about it. It was a very strange experience. And he was pretty freaked out by it as well. So he went into work and he said, you've got to drive straight to the sort of walk-in centre. And that's what I did. When I went in, they did a blood test and they just said, we'll let you know if there's any results. But they couldn't really see anything on the surface that there was an issue, if that makes sense.
And did you have more symptoms after that? What happened?
My symptoms did get progressively worse. So I then continued to get more back pain to the point where it was excruciating. And then this sort of numbness and passing out continued to the point where at worst it was 4 or 5 times a day. So I was becoming anxious that it was going to happen. I then went for another blood test. And after I had my blood test, I was pretty weak at this point. I remember feeling particularly unwell at this point. I passed out in the street as me and my mum walked to get some food. An ambulance came to pick me up. A doctor came in. They asked me some really awkward questions in front of my parents, as you can imagine, about things to do with like sex life and STDs. Yeah. But then they sort of felt my stomach. And that's when she felt the tumour. She didn't know it was a tumour at the time, but she felt the tumour in my stomach. And she said, I think we need to send you for a CT scan just to be sure. I remember going down for the scan. They came back up and pretty much very quickly said, we're diagnosing you with testicular cancer.
Let's talk about treatment.
Yes.
What are your options?
So during the diagnostic period, you would have had your testes removed. And for the majority of patients, that's all they need. We now do have some further information because we've had a chance to look at the testes under a microscope. That allows us, as well as with other tests, including CT scans and blood tests like the tumour markers, to build a picture. That picture allows us to kind of put patients to decide whether they're in a low risk of the cancer coming back. So in those patients who have a low risk of cancer coming back, we offer surveillance, which involves regular tests with us, with blood tests as well as scans at certain intervals. In those patients where we feel the risk of the tumour coming back is much higher, we have a discussion with patients to decide on whether we offer some chemotherapy to reduce their risk of their cancer coming back.
And how does that work?
So chemotherapy is basically a drug treatment that is delivered through your veins, and it's a treatment that goes through your bloodstream and kills cancer cells. that we can't see as well as cells that we can see. Obviously, in patients with early testicular cancer, there may be small cells or microscopic cells through the blood system that we can't see. So we are trying to kill those as well.
So basically, it goes around the entire body and kind of aims or targets any cells that might be around.
Yes, unfortunately, it kills cells that are growing more quickly, and that's why it can kill some of your normal cells that divide more rapidly as well. And that sometimes can lead to some of the side effects that chemotherapy gives.
So that would be the story for someone diagnosed in earlier stages, for instance, stage 1 testicular cancer. What happens if you're diagnosed in stage 2 or even stage 3?
So a lot of those patients would have a combination of surgery as well as chemotherapy. In the more advanced stage tumours, the stage 3s, a lot of those patients may have the chemotherapy first before going on to have their surgery. That's to treat the cancer that has spread outside of the testes. So as this chemotherapy goes throughout the whole body, it will help to treat all of those cells. It will also help to shrink the cancer within the testes as well.
Lots of people will worry about side effects of testicular cancer treatment, particularly if removing a testicle affects your fertility or your sex life.
So if your remaining testes is healthy, your fertility won't be affected. You will still be able to produce sperm. So most patients before having the orchidectomy would be offered to have their sperm stored, so just in case you need chemotherapy after the operation. In terms of the sex life, a lot of patients, it shouldn't impact your sex life. Some patients may not feel like having sex whilst they're having all of this going on, including if they're having other additional treatments for their cancer.
It's perfectly normal to feel differently about your body after an orchidectomy, isn't it?
Yes, I mean, a lot of patients may feel a little bit self-conscious about only having one testicle. Others may be completely fine about that. So prior to the orchidectomy, when you're meeting your specialist, they would discuss with you about whether you want to have a artificial testicle put in once they removed the testicle. Artificial testes won't produce any sperm, but hopefully it helps maintain the look and feel of a testes.
And you don't have to make that decision straight away. You can do that later.
Yes, you can have that discussion in terms of a later stage with your specialist.
Thank you, Dr. Narveed. Now, back to Ryan to find out more on his cancer experience, including some of the side effects that he faced during his treatment. You started your treatment. What sorts of options did you have at that stage?
So I started on the standard typical chemo cycle called BEP chemo.
Okay.
They saw that worked quite well. They were happy with how well my body reacted to it and how much my tumours were shrinking because of it. So I started on the BEP chemo. Then they put me on a 3-4 month cycle of POM-ACE chemotherapy. I had a little break over the Christmas holidays, which was nice and needed.
Yeah.
And then they put me on gem-tip chemotherapy. And that was the kind of baseline for having a stem cell transplant. So during that break, my consultant said to me that I think you might need a stem cell transplant.
So you had several rounds of chemotherapy leading you up to a stem cell transplant.
Correct.
Did you have side effects from your treatment?
It was mainly from the stem cell transplant. So a lot of the side effects that I had from the original chemo, that was all your typical hair loss, fatigue. But the stem cell transplant was the main thing that caused a lot of side effects. So I've got neuropathy in my hands and my legs. Well, I'm infertile now, so I can't produce sperm. That was from the operation. I also have tinnitus in my ears, hence why I wear hearing aids. Those are the physical side effects. The sort of harshest side effects were more emotional, really, for me.
In what sort of way?
The sense that I feel like I lost myself was the main thing. I was a very positive person. I was a very sort of jokey person, happy person. And then I started seeing the negative in everything. I didn't like doing anything. I felt like a burden on everyone because my infertility made me feel like I couldn't provide a family for my wife and her family and so on. So it really just, it made me feel quite in a low place.
Must have been really hard. And what's your health like now? Because you look so well, which is great.
Thank you. Yeah, I'm 7 years cancer-free now. Pushing on to that 10 years mark, which is the big one that we all try to aim for. 5 years was massive, but 10 years, I think you can start to fully put it in the back of your mind. With the fertility side of things, I had to have a retrieval operation for them to try and remove some sperm from the testicle.
Yeah.
When I originally woke up from that, they did say that they couldn't get anything. However, they then rang me a few hours later and said they managed to get 2 vials from the surrounding tissue. So they then said I can now use that for IVF, ICSI, which we did, and we have a little boy. So yeah, it was incredible.
And you've just celebrated his first birthday.
Yeah, just recently celebrated his first birthday, and that was the biggest turning point in life for me, really. Like I said, all those feelings of not feeling like you're worthy, not feeling more like a burden to people, to then have that just disappear at the birth of him was just the most freeing experience. And now I don't really see anything negative at all. I feel like I'm positive again. I feel like I can take a joke a lot better. I feel like my humour's back, and it just feels back to being me.
Thank you so much, Ryan, for sharing your experience with us. And thank you, Dr. Narveed, for sharing those brilliant explanations. Remember, the main symptom of testicular cancer is a lump or swelling in your testicle. But any changes or any symptoms that are ongoing, unexplained or unusual for you should be checked by your GP. For more information or support, call 0808 808 0000 or visit macmillan.org.uk. Now, before you go, if you found our conversation on testicular cancer insightful, helpful or useful, please don't forget to hit the subscribe button. You can also like this video and share your thoughts or questions in the comments below. Thank you so much for watching.